So people with previous inflammation inside the eye, that is an issue for us. When we undertake cataract surgery, we actually go in the eye and we eat away the lens, and that causes inflammation inevitably. We control that by giving you steroid drops or non-steroidal anti-inflammatory drops after the operation, and most people settle down. Even in patients who haven't had a previous inflammation, very rarely the drops don't hold the inflammation, and we find that after they stop the drops, after 3 or 4 weeks, the inflammation comes back, the eye becomes red, a bit photophobic, so bright lights bother you, and then a sort of achy sensation, and then we've got to put them back onto drops and give them more drops. In some people who've had previous inflammation inside the eye, something called iritis or uveitis, you're already predisposed to getting inflammation, so we've got to be a little bit cautious. There are also other conditions whereby you have chronic inflammation, something called Fuchs heterochloric iridocyclitis, where you have a low-grade inflammation anyway inside the eye. In these circumstances, you can get an excessive inflammation afterwards, plus or minus a raised pressure inside the eye. Sometimes we give you steroid drops beforehand, we increase the amount of steroid drops that you use afterwards, and we're very careful about tapering the steroids down. The outcome is usually very, very good. We don't like to operate on an angry red eye, so if you are having active inflammation, we may hold fire until you're clear of it. In an ideal world, you should be 6 months clear of your last inflammation. However, it's not an ideal world, and sometimes people don't have bouts of being clear that long, and then we have to operate. It's about being informed about it, about the surgeon taking the appropriate precautions and thinking about it properly and making an individualised plan for you. So if you do have uveitis, make sure you discuss it with your surgeon, and they should be able to make a plan for you. But you can still have cataract surgery, and actually the uveitis self-stimulates cataract, so you're more likely to require it at some stage.